My presentation is on social justice as discursive frame for the COVID-19 vaccine in online news reports in South Africa from July 2020 to March 2021. My home discipline is psychology, so my presentation is structured in quite a traditional scientific way with the background and about the established knowledge, then the research methods, and then some preliminary findings on the topic. The discovery, manufacture, and availability of the COVID-19 vaccine as a global bioethical field of competition and imbalance has foregrounded social justice as a new topic in countries, particularly in those where the vaccine was not developed or easily made available. Presupposing social justice as a frame, this study investigates the problem of vaccine availability as portrayed in South African online news reports, dated from the time of the publishing of the availability of the phase 1, phase 2 clinical trial data until 2 months after the vaccine arrived in South Africa. When I started out, I had hoped that this period would be restricted to just South Africa and the local terrain, and that by May this year, in other words now, that the public representations of justice would not have reached global proportions. However, it has. South Africa received vaccines on February 1st in much fanfare from India. As everything else in this pandemic, the vaccine climate is changing dynamically and globally, and changing to such an extent that the humanitarian disaster unfolding in India right now has changed social justice into an issue for global society rather than just for South Africa. Yes, in January, there was talk about vaccine apartheid and its impact on lower income countries, even at that time. The spread of variants, the lessening of restrictions, and in South Africa, the withdrawal of usage of that first batch of vaccines from India meant that social justice would, however, remain an ongoing topic. I nevertheless present a preliminary analysis of social justice in this initially intended time period from July 2020 to March, but I plan to extend this period for the final paper submission because of the recent developments and talk about vaccine apartheid. So I'm going to go to the background for this study. The interdisciplinary springboard for this study, coming from psychology, is critical health psychology. And this discipline brings ethics and politics to the once empiricist domain of health psychology. The individualist functionalist approach, often termed the biopsychosocial model, in health psychology did not engage with the social dimensions of illness, such as social justice. Critical health psychology's mandate, in contrast, uses critical theory and analyzes social inequalities and sees this as a result of poverty and inequities in the world. The COVID-19 pandemic has ensured now that all health psychology should be critical health psychology. In this view, health is studied with reference to ethics and philosophy rather than just variables. Health professionals are agents of social change who enable social justice. Not such a revolutionary discipline any longer, critical health psychology aims to resolve dichotomies such as mind and body and individual and society, and as such its task is inherently and always one of philosophical engagement. Philosophical grounding, nonetheless, is needed in times of uncertainty and in a pandemic because of the socio-political impact in the contemporary world. Delanty, who is an interdisciplinary sociologist at the University of Sussex, argues that a deeper critical philosophy is needed because utilitarianism, the Kantian view, and libertarianism are inadequate. Certainly, the factors now at stake are globalization, economics, and newer forms of governance and public discursive orders than just a focus on the individual. In the pandemic, the establishment of emergency governments, such as the state of disaster in South Africa, shows that what is at risk is the social bond itself. Thus, a commitment to social justice involves analysis and critique using a globalization perspective of the world. Social justice is rooted in finding a balance between an individual's freedom and social solidarity, and these are typically dealt with nationally. A pandemic is an exception to this because public health is inserted into the social justice task so that benefits of interventions can accrue to all persons. Ethics, which enters here, thus needs to be framed as protective in health interventions, so that restricted individual autonomy must be accepted through individual acts of discipline. Outside of pandemic times, what has become standard is that the clinical encounter has come to deal with prevention and health promotion, thereby dissolving the public health and medical care boundary. COVID-19 has redrawn this boundary because public health takes precedence. According to Kotel research, the medical encounter and public health are brought together under protective ethics. Bioethics as a paradigm emerged out of the harmful effects through the intersections of economic investments with applied technologies. The contemporary commercialization is not about patenting products only, but also about patenting processes leading to global competition. In vaccine development, the substance and process are thus patented by a company. Patent pooling has not been met favorably, however. COVID-19 has forced bioethics to also have social relevance because the questions that are now being foregrounded are about social justice. The point is that bioethics, once assumed to be just about individual decision-making, has been required to expand its reach beyond usual themes such as biotechnology, consider human rights, remove its first world bias, and intervene in global inequalities because of dilemmas and choices that are never personal. The COVID vaccine, simply put, needs to be considered as a bioethical event operating within the social justice project. This research takes this presupposition. Because vaccine manufacture, availability, and distribution have been pushed into a terrain of dispute, particularly in these exceptional circumstances where the research and production was fast-forwarded, with developments and duties of countries and groups becoming quite dynamic, the approach used in this analysis is positioning theory, a theory that is useful as a social interrogation tool. For it is social positioning that contributes to risk and visibility, which then informs the management of public health emergencies. I'm unable to move my slide, so I'm going to go on to the methods. Oh, sorry, it's there now, the methods. So the research method for this, for this presentation and for this study was positioning theory, which is a social justice interrogation tool. Social positioning can be used to understand the vaccine distribution and social justice because social positioning contributes to risk and visibility, which then informs the management of public health emergencies. Originating in social psychology that draws from Foucauldian philosophy, positioning theory shows that shifting workings of power in relationships where duties and rights are contested. It contributes to the social justice paradigm by analyzing the power amongst diverse social groupings, uses critical ontology, is linked with political philosophy, and is therefore suitable for researching social justice issues. It's different from role theory, where stakeholders, persons, or countries are fixed. Positioning theory considers actors to be fluid because of their rights and duties, and these are determined by discourses. Storylines based on historical authoritativeness creates practices that specifies duties. Because roles and positions are not universal based on storylines of universal cultures and groups, positioning theory can be used to understand intergroup relations and conflicts and help to deconstruct contested narratives, identities, and duties. Positioning theory has cross-disciplinary origins with many varieties and has been influenced by Foucauldian and Marxist philosophies. The existing order and injustice are interrogated in this method, whereas conversations bring up individual narratives. The COVID-19 vaccine representation requires an analysis of group positions and narratives. And this is done through analyzing power dynamics in storylines at play between groups. The object at stake, a vaccine, is not a public good. It is national defense. It requires collective action in the form of nation states cooperation, primarily because individual corporations or countries can still act privately. So this study used, I'm going to see if I can move to the next slide. This study used press reports, and these were analyzed to study the dynamics of social justice and the access to the new technology that was the vaccine. Particularly relevant to the pandemic and vaccine, the period under study from July to March entailed using search terms on 5 online websites, press websites, and the search terms were COVID, South Africa, vaccine, and social justice. That did not bring enough, or rather substantial material, but when I added the term jabs to the search, I ended up with a bit more relevant material. News reports in the search results were first checked for dates, and those outside of the period under consideration were excluded. Those remaining were then read to ascertain if social justice was used as a frame. Those articles without this frame were also excluded, along with others that were not publicly available because they required a payment for those articles to be made accessible. The initial findings that I now present are based on these articles, although a better search or further search can be done using the term vaccine apartheid that has come up in the last 2 months, that is after March. The preliminary findings, if I can look at this, the interesting finding first was about the positioning of South Africa. In one Al Jazeera report, South Africa was positioned within the block of poorer nations being left behind, with this being a race and this being called a dangerous situation. Another Al Jazeera report linking the global public health to colonialist origins contains segments detailing social injustice as rooted in 19th century sanitary conferences. In a local newspaper, a February article in the newspaper called The Sowetan, a hoarding discourse was used to position South Africa as an outsider to vaccine availability. Hoarding as an outcome of vaccine nationalism was called out by the South African president, showing South Africa to be a spokesperson and activist for poorer nations. As the symbol of the win of social justice over oppression, South Africa has in this way a global duty to lobby for equitable access to the vaccine. Even the international relations minister in South Africa did the same, saying that packaging and trials of the vaccine were done in Africa, but access to the product was still limited in Africa. The hoarding discourse was also used by the health minister, who said wealthy nations had begun to hog the stock, adding that the moral duty was for those nations with stock to release those stocks. He positioned South Africa as a buyer, saying, "We are not asking for charity." The minister's comment shows a commercialization of technology is still happening, and the minister's comments positions vaccine hoarders as selfish, but it aims at retaining the pride of South Africa as sovereign with economic capability and a responsible caretaker for its people. Here, social justice became commercialized, itself a product that can be purchased, just such as when the minister said, "We are not asking for charity, we will buy." Two topics, though, were debated in the sample. The first was the AstraZeneca jab that was found to have reduced efficacy for the South African variant of the virus. Using a discourse of thriftiness, which would be expected in a middle to lower income nation, one article warned against wastefulness with the headline, "Give India vaccine to healthy people." The report positioned persons within a riskier health profile as being candidates for the more deserving of the Johnson & Johnson vaccine, the vaccine that was to replace the original AstraZeneca vaccine that had originated in India. In all these reports, protection was understandably foregrounded. In philosophical terms, this is technocratic governance at work, where the form of discipline is now about safety and not about freedom. Across three newspapers in South Africa, Justice assumed a front stage. This is around January, framing those articles that reported prisoners as being prioritized for the vaccine. This group was counterposed against ordinary citizens, innocent citizens, and law-abiding citizens who were literally millions of hard-working, tax-paying members of the public. And these people or these groups were positioned as more deserving. These comments were made by the South African opposition political party representatives. Defending the prioritization of prisoners were human rights activists and the famous judge who cited overcrowding, easier transmission, and a moral duty of the government to vaccinate prisoners first. The discourse here in trying to make the debate understandable to the public was first legal discourse, for example, referring to precedents for making ARVs available to prisoners in the past, and second, a human rights discourse, both used to defend the stance of vaccinating prisoners. The overall framing was about overwhelming of the health superstructure if prisoners were not vaccinated early. The implication was that citizens or non-prisoners would have access to healthcare and security down the line if prison outbreaks could be prevented by vaccinations. On to my last slide. The portrayal of social justice is aligned with a needs-based approach. That is one based on risk, particularly when resources are limited. The last group, other than prisoners, was health workers. Of course, these fell into the category of citizens, the priority people, the people who were vaccinated in phase 1. And over here, a discourse of welcoming was used. This positioning, for example, is shown through first-person health worker testimonies, such as, "I wish I would receive it as soon as possible. As a frontline worker, I know what it means to be vaccinated." Another famous headline that stood out was, "Letaba nurses wait in anticipation to be vaccinated." The responsibilities of these recipients is to express joy and to show readiness in this portrayal. So in conclusion, I see my time has just run out. The analysis over here, discourse analysis and subject positioning analysis, was to look at newspapers and to look at how different groups are positioned against each other and in opposing frames, like prisoners versus citizens, healthcare workers versus those that should not be prioritized. And also, and I think this is what further analysis is going to show, the positions above various blocks in the world, geopolitical blocks, and countries in the world in terms of vaccine apartheid. Thank you.